This is Good Morning Mumbai with HrishiKay.
Welcome back. The World Health Organization, WHO, has earmarked a World Hearing Day, and one of India's foremost ENTs, which is the wonderful Dr. Sanjiv Badhwar, has been spending time in studio talking about, the prevalence of hearing loss, the impact, ambient noise levels, safe listening, and a lot more. Now, Sabita says on WhatsApp, what does one do about ear-splitting firecrackers? That didn't make it to our list, but it should.
Yes, good question. What does one do with a firecracker which sounds up to 150 decibels? My answer, education, legislation.
150 decibels, my
Yes.
God, that's more than a throbbing nightclub. Yeah. Okay, now let's talk about hearing aids and sudden hearing loss. Let's cover that.
So that's a good question because a lot of people come in and ask about the use of hearing aids. So till a couple of years ago, you had analog hearing aids which would amplify all sounds, wanted or unwanted. But now with the advent of digital hearing aids, which are multi-channel, 40 channels plus, these hearing aids are customized to your hearing loss, the ambient noise, the feedback is cut off, and you have your mobility with your telephone, your television, your Bluetooth devices, and it's a whole new ball game. But there's a caveat. You need to go out to a recognized hearing aid center and make sure that you get good professional advice.
Sudden hearing loss. That is something that everybody should be forewarned about.
Yes. This is becoming quite common of late. An individual comes to us saying that you've woken up one morning and you can't hear from 1 year at all. This is a medical emergency. The causes are either traumatic, mostly viral. Sometimes it may be related to some tumors in the ear, but most importantly, you have 10 days to sort it out. And if effective intervention is done with medication, sometimes injection in the ear, and most importantly, hyperbaric oxygen therapy, only 15 to 20% of these recover. So I would like to again re-emphasize, if you have any such issues, please visit your nearest ENT doctor without delay. Post 6 months to 1 year, if you still have sudden hearing loss, we have effective interventions with devices like cochlear implants and bone-anchored hearing aids, which give extremely good results.
Let's talk about cochlear implants now. That's a special baby which is very close to your heart. Talk me through that.
Yes. So at Cochlear Hospital, we have a wonderful program for cochlear implants, which addresses people from all socio-economic strata. Up to the age of 5 years, the government sponsors free cochlear implants, and we work very closely with the National Institute of Hearing Handicapped at Bandra, wherein children who meet the requisite data are enrolled, and the government provides cochlear implants free of cost. So the age group is from 1 year to now recently even people of 65 years plus. So the idea is that the center of hearing in the brain after the age of 5 years starts undergoing atrophy. So you have to intervene early. Either you use it or you lose it. So a cochlear implant is a device which has two parts. One is external, the other one is internal. The external part is a small microphone. It has a processor where the sound is captured, it is digitized, and then this is transmitted across the skin to a receiver stimulus, which again makes into an electrical signal which bypasses the normal channels of hearing and directly stimulates the nerve. The surgery time in this has come down considerably, and now is only 1.5 hours. Hospital stays just 1 to 2 days. So with very good results the world over. Once the implant is done, post that after 3 weeks there is a process called switch on where the implant is activated. But surgery is only one part of it. We work with dedicated professionals from the field of audiology, wherein a concept of auditory verbal therapy training comes in. The family also plays a very great role in this, where the child is taught to listen to sounds, words, and sentences. So a child who's prelingual, a child who's not speaking, after 6 months to 1 year start speaking, and our goal is that the age of 5 the child should attend a normal school, and we are achieving such results. More and more now we're even doing bilateral implants, that is, in one go both the ears are addressed, so that the effect of hearing only one side, the shadow effect, all are obviated. Now, to enable this program to be successful, we go out to remote areas and conduct screening camps, wherein we do screening for children, various age groups, to pick up children who are hearing challenged and advise intervention. On one such trip, we visited Bhuj. We went right out to the run, and we met with a child, which is a human interest story, a child called Harsh, a beautiful young boy who was abandoned in a dustbin. Post that, he was picked up by the orphanage in Bhuj and taken care of really lovingly. So when we met him, the child was 4 years age, and they were working towards adoption. The only issue was the child doesn't speak. So with the help of the government program and with the help of the authorities at Cochlear Ben who helped us in this, the child has undergone a cochlear implant. The switch on happened last week, and he's well on his way to becoming an individual who can hear and speak.
Lovely. You're such a great ambassador for the WHO and the World Hearing Day program. Kudos to you. Before we go, where can people reach out to you? Is there an email? Is there a mobile number? Something that they can immediately access to reach you, Doc?
Okay, we would welcome messages at this number, 986 777 8584.
Repeat that.
I repeat, 986 777 8584. Mail ID, audiology.kh@relianceada.com. I repeat, audiology.kh@relianceada.com.
Okay, now before you go, you want to dedicate a song to the family, the three lovely ladies, and this is the Jonas Brothers. Nick Jonas recently got married to Priyanka Chopra, and PC is also in the video, and it's a fabulous hot current hit that I've picked out for your family.
Yes.
So what would you like to say?
Yes, this goes out to my wife Anu, Sana, Pooja, and my son-in-law Tarun. God bless.
Super stuff. Doc, have a wonderful day ahead, and keep up the great work you're doing. Cheers.
Thank you, Rishi.